Herbs, acupuncture, therapy. That's what comes to people's minds when they think of alternative medicine. Alternative medicine can be defined as any practice that aims to achieve the healing effects of modern-day medicine. In Western society, alternative medicine is not as administered as it should be.
Good morning, my name is Sana Siddiqui.
My name is Alison Hackett.
My name is Nicole Kim.
And my name is Ethan Wu. As a team, we have explored the question, should alternative medicine be implemented in Western practices of medicine? After our research, we have concluded that yes, alternative medicine should be implemented in Western practices of medicine due to ethicality, validity, cost-effectiveness, and culture.
Alternative medicine aims to prevent diseases before they occur, reducing chronic conditions and healthcare costs. Emphasizing prevention, it fosters a healthier population while positively impacting the economy. Dr. Dan Petrovich and Dr. Christopher Ritson conducted a study to identify the factors that impact the individual decision to engage in dietary health preventative behavior, or DHPB, and investigate their influence in the context of an adapted health cognition model. It concluded with respondents' health motivation, beliefs that diet can prevent disease, knowledge about nutrition, level of education attainment, and age have a positive influence on DHPB. Petrovich and Ritson's study found that health-motivated individuals are more likely to adopt preventative health practices suggested by alternative medicine. This proves that these individuals are more likely to take a positive approach to these preventative health practices brought up by alternative medicine, resolving their health issues. Although alternative medicine stands as an option for treatment, many doctors exclude it when reviewing treatment plans with their patients. Individuals refrain from looking into alternative medicine treatments due to the lack of information available and ethical concerns. Despite these concerns regarding information and ethicality, alternative medicine is still widely accepted globally. Dr. Helen Boardman and her colleagues present the positive views on alternative medicine, including benefits, safety, affordability, accessibility, control of health, and a holistic approach. A bar chart made by the same researchers illustrates patient perspectives by race and country. The data demonstrates every population's highest statistics align with the perception of benefit, indicating the many positive views towards alternative medicine treatments. Like conventional treatments, alternative medicine must conform to specific ethical guidelines. Dr. Hee-Jin Kim from the Konkuk University Medical Center in South Korea quotes, "From an ethical point of view, all relevant information about treatment options should be given to patients. Informed consent is dependent on the patient's competence to understand treatments and their consequences, and also on the ability of the healthcare provider to inform the patient appropriately." She emphasizes the importance of providing comprehensive information to patients for informed consent, as well as monitoring patient progress throughout treatment for ethical care. This is all ensuring healthcare providers meet outlined standards outlined here for introducing, consenting, monitoring, and evaluating results in alternative medicine practices. This infographic, shaped by the Department of Thai Traditional Alternative Medicine in Thailand, presents the statistics of the acceptance and usage of alternative medicine treatments among other healthcare departments. With the 25 studies, the concluding results shown in these forest plots are that almost all departments of healthcare utilize and accept alternative medicine, most by family medicine and the least by surgery.
Building on what Nicole said, the orange circles shown here describe the total number of participants in each study for each specialty. The green circles stand for the percentage of willingness that a participant has to make that switch to the alternative medicine option. The total number of participants to percentage of acceptance ratio is a lot larger in pediatrics than that of surgery. There are 4 main types of pharmacological treatments that can be used to prevent type 2 diabetes. These include emotional therapy, acupuncture treatments, healthy food intake, and physical exercise. These options provide a safe and easy way for these ways to treat someone. For example, researcher Jingyang Liu says that these non-drug interventions were effective in patients with type 2 diabetes, reducing the risk of complications, delaying its progression, and improving the life quality of these patients. The effectiveness of these treatments are shockingly practical for their availability. Physical exercise requires nothing but time and effort. For example, aerobic exercises like running are simplistic yet effective. This graph by Dr. Kim Un-soo shows a comparison of different medicines in 3 different countries, China, Japan, and Korea. He says that there's a significant gap regarding complementary alternative medicine usage among different Asian countries, not only from the patient's perspective, but from the physicians as well. Overall, throughout all 3 countries, the highest number of patient to participant ratio is greatest when talking about probiotics.
Natural therapies, dietary modifications, and lifestyle adjustments used in alternative medicine make it more affordable than many biomedicine procedures. Traditional Western medicine's expensive procedures, medications, and lengthy hospital stays impose a significant financial burden on patients in the healthcare system. In contrast, alternative medicine employs affordable natural remedies, lifestyle shifts, and holistic approaches, offering accessible and economical healthcare options which alleviate the financial strain on the healthcare system. The analytical paper written by European Dr. Soren Ventegot compares the economic aspects of alternative medicine and biomedicine on various treatment costs. The variation in the expense of treating anorexia nervosa is one startling example from the study. The anticipated cost of using alternative medicine for this particular disorder is significantly lower than that of using biomedicine. Biomedicine is estimated to cost $107,000, while alternative care is only $6,500. These results highlight the significant cost effectiveness of complementary and alternative medicine, making a strong case for its integration into Western practices as a way to provide high-quality care at lower costs. Promoting healthcare diversity via alternative medicine not only embraces the quality of life, but stimulates economies, creating new jobs and businesses. Embracing diverse therapeutic approaches fosters creativity, embracing economic growth to meet varied health needs. A study conducted by Australian researcher Stephanie Drews found that out of 818 general practitioners, 448 had positive attitudes and a higher job satisfaction and physical working conditions. And they scored significantly higher than the rest, which had negative and neutral attitudes. This suggests the connection between positive attitudes and general professional satisfaction, and these variations imply that incorporating alternative medicine improves job satisfaction for medical staff, creating new jobs and inspiring individuals to become health professionals.
Traditional Chinese medicine includes many tactics, specifically both herbal medication and acupuncture. Medicine specialist Dane Cassilis say that some recent evidence supports the benefits of acupuncture into conventional medicine setting, particularly improvements in physical and emotional symptoms, increased quality of life levels, and reduction of drug side effects. As stated, both herbal medication and acupuncture are said to improve an individual's emotional and physical issues. There's a variety of alternative medicine practices. These include massages, acupuncture, herbal medication, tai chi, and a variety of teas. Each of these alternative medicine practices have been used in multiple cultures for centuries. Depending on the culture that use these practices, they're each linked with certain cures and preventative measures. Researchers Chetty Chai and Camacho state later efforts popularized traditional medicine as an expression of Thai national heritage and cultural identity. With each culture, there comes the many cultural aspects linked to alternative medicine. This includes mind-body medicine, energy medicine, biology-based practices, etc. Each aspect is connected to more practices of alternative medicine depending on the culture that uses that certain aspect. Mind-body medicine uses your thoughts to influence your physical health. Energy medicine uses things like therapeutic touch to help benefit the mental and physical health of the body. Biology-based practices are the use of herbal medication or natural remedies to help heal and benefit the health of the body. These three examples of alternative medicine are said to offer numerous advantages for the body. This slide shows the limitations, which include but is not limited to the negative impressions on the tactics, efficiency, and validity of alternative medicine, and the lack of regulation of quantities from the patient's side with the procedures associated with alternative medicine practice or treatments. And on this side, it shows these solutions, which involve exposing patients to valid information about the different types of alternative medicine treatments, such as the benefit and cost of it, and also healthcare professionals can map out a schedule for the patients to follow to regulate quantities during their treatment.
We declare alternative medicine is scientifically valid, cost-friendly, and ethical. Its implementation to Western society would substantially improve healthcare in various aspects and allow patients to have more variety in treatment, since it can be a more affordable option than biomedicine practices.
Thank you.
Thank you.
All right, Nicole, we'll start with you and then we'll work our way across. Nicole, can you tell me how you used Ethan's paper in this presentation?
So, Ethan talked about in his paper, he talked about the validity of scientific results regarding alternative medicine. So we decided to use his paper in regards to our argument to prove that alternative medicine should be implemented in Western practices of medicine today because it has been proven to be efficient according to results with scientific studies and resources and research conducted by many health professionals and so on. So that's how we decided to include this paper so that we can prove that alternative medicine should be implemented in Western practices of medicine because of its validity and effectiveness.
Okay. Sana, reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem?
I would say Ethan's paper as well because he talked about the scientific aspect and how alternative medicine can actually work, and just because it is economical and more affordable, its scientific aspect is as important because also she talked about the ethicalness and the educational, and a lot of people might not know that it is scientifically proven. So all of them really helped me, but I would say Ethan's the most.
All right. I'm sorry, guys. Is there anyone's paper that wasn't used, and if so, or parts of anyone's paper that wasn't used, and if so, which one and why?
Part of Ethan's, he mentioned the blend of Western and Eastern medical practices, but we didn't include that in our presentation because we felt like it wasn't relevant enough to our argument, because our argument stated that alternative medicine should be implemented in Western society or Western practices, but the blend of Eastern and Western was kind of like straying to the point of that it is already kind of, we didn't think it was relevant.
Okay. And Ethan, if you had a fifth member of your team, what could they have added to this that would have helped the presentation?
If we had a fifth member to our team, we want the environmental aspect because it shows that alternative medicine is a lot like eco-friendly, and complementary alternative medicines are very, like, they use plastic and it's unreusable. Us as a team, we said that it should be implemented, and adding the environmental aspect will help us understand that it's a lot cheaper and affordable and bio-friendly.